everyone. I am Dr. Sudakshina and I am the Training Center Chief of Chettinad Skills and Simulation Center. And today we are conducting a workshop on virtual simulation, hands-on session. And with me, I have two young medicine doctors, and they are from General Medicine Department. And Dr. Anuja is a senior resident, and Dr. Gowtham is the assistant professor of our General Medicine Department, CHRI. And we want a few words from them. Actually, what was their experience and what exactly they did, and how was it different from doing physically these skills, and how was it in the virtual reality? Yeah, Dr. Anuja, can you tell us?
Yeah, so it's the first time I am experiencing this virtual teaching experience, and it was amazing because it's the first time actually I'm doing it, and it's like exactly like how you're doing it in front of a patient. You have a patient in front of you, you have the all the equipment in front of you. You just have to operate the VR machines virtually. So I think it was a great learning experience and helps us to teach much better if we keep having such
It's
classes.
kind of exciting and interesting, and you
also.
should not miss out steps.
True.
Because when you miss out, they say that you are missing out the steps. So
Yes.
everything should be step by step. You
Yeah,
take the aseptic precautions,
Yeah.
all those things. Okay, Dr. Gautam, how did you feel and what exactly you did?
I like ma'am said that this is my first experience in the virtual learning and virtual teaching. So I performed how to perform an ECG for a patient. So this virtual representation is like as ma'am said, so much exciting and it's like so user friendly also. The way to operate the machines or the way to work on it is also very easy, and it's like it's a typical ditto of like how we are like going to perform in the physically the same. And all the AIs what we have like they have represented is also so natural and it's so good to, and for young faculties like us and like students it is like way more like welcoming, and we are like more interested in performing these virtual things also. Like I did an ECG, how to perform ECG for like in a virtual learning. It's like
And the placement of the
leads,
leads and
yeah,
all
we
that.
did. Like physically we can able to like we should bumble up with steps like this comes first, this comes like next. But in a virtual learning, we will be hearing like voices like this should be done first. It's in a very like systematic way we are doing to perform and getting documentations of everything, each and every aspect, both from the personal like medicine view and also from the patient's view. Also, everything is targeted, and it's like so we are welcoming it and we are ready to go.
Yes, very nice. Thank you. It was nice teaching learning experience. I hope the students also will enjoy it, right?
Yeah,
Because it
definitely.
is not like these boring teachers talking to them. So thank you so much for coming and experiencing it.
Thank you.
Thank you.
Thank you. Thank you so much.